By February, it became clear that we finally had a partner at the federal level. After a tough year, that's when I finally started sleeping through the night. A few weeks ago, every adult in Virginia became eligible, and recently the FDA allowed 16 and 17-year-olds to get the Pfizer vaccine. So far, we have vaccinated almost 63,000 young people between the ages of 16 and 17. So this is all very good news. We expect the federal government to approve the Pfizer vaccine for children aged 12 and over very soon, perhaps as early as next week. You don't have to be a pediatrician to know that that's good news. Parents are eager for their children to be able to get this shot. Preliminary results from a VCU survey tell us that a large majority of parents, 66%, plan to get their adolescents vaccinated. 63% will vaccinate their younger children when it's available. This is great news for getting back to normal, and we're ready for it. Our Virginia Department of Health has been planning for the best way to get adolescents vaccinated. We are working with school divisions and superintendents to encourage everyone to get a shot. Our teams are meeting with school divisions early next week, and I know our colleges and universities are meeting regularly too. Everyone is making plans for the future and how to reopen as safely as possible. I'm confident they will all make the right decisions in the best interest of their community. The bottom line is that we want everyone who can get vaccinated to get vaccinated. I got a shot, my family got a shot, everyone who works in this building got a shot. I hope everyone in this room today got a shot. And I'm seeing pretty good eye contact from everyone, so that is encouraging. And getting your COVID vaccine has never been easier. Vaccines are now widely and easily available in Virginia. They're in grocery stores, in doctors' offices, in pharmacies, the places where you're used to getting your health care. And of course, they will continue to be available at your local health department and in hospitals across Virginia. Our community vaccination centers are CVCs, large sites with the ability to give thousands of shots per day. Just this week met our goal to give 300,000 shots. And next week, we will launch new mobile vaccine units. Together with local health departments, these will focus on underserved areas. You're starting to see other steps forward as well. All of our community vaccination clinics now welcoming walk-ins. So are many of the pharmacies in Virginia. You can just walk in and get your shot. You don't need to register and you don't need an appointment. You just go. And this is, again, good news. It's what we all envisioned when we heard a vaccine was finally ready. A vaccine that is easy for everyone to get. To find out where, again, go to vaccinate.virginia.gov and type in your address. The federal government also just launched a text feature. You can text your zip code to GetVax. That's GETVAX. And it will tell you 3 vaccination sites near you. Or you can call your doctor. They can point you in the right direction. All of these are positive developments. They are huge steps forward. We still have a lot of work ahead to meet President Biden's new goal of 70% of American adults getting at least a first shot by the 4th of July. But make no mistake, I feel confident that Virginia can do our part to reach that goal, and we will. Now, like most other states, we're seeing a change in demand for vaccine. That yellow line is our average daily shots. We know there are a variety of reasons why someone who is eligible hasn't been vaccinated yet. Some people may not know that they're eligible. I want to be clear. The only eligibility requirement now is that you're 16 or older, and soon that will probably be 12 or older. And it doesn't matter if you are a frontline worker or have a medical condition, everyone 16 and up is eligible. Others may not realize that they don't have long wait lists for appointments anymore. Now getting vaccinated is easy and free. You don't have to pre-register. We have an address search tool on vaccinate.virginia.gov, and you can call 877-VAX-IN-VA as well for help finding a place to get your shot. And some people haven't made it a priority yet, or they're uncertain about a new vaccine for a new disease. If you have questions about vaccines, we'll be glad to answer them. And I'd also encourage you to talk to your provider. They can tell you that while these vaccines may be new, they are built on years' worth of testing, research, and experience. We're going to keep reaching out to all of these folks. The bottom line is when you get vaccinated, you protect yourself, you protect your family, and everyone around you. Over the past 14 months, we've learned a lot about COVID. And one thing is that it is an unpredictable disease. It can put anyone in the hospital, including young people. It can cause long-lasting, debilitating side effects. As you all know, I had COVID myself last October, and 7 months later, I still can't smell or taste anything. Many long-lasting side effects are much worse. If you haven't gotten the vaccine, remember this: COVID can make you truly sick for months. The variants that are now circulating raise the risk of getting sick. So please protect yourself from going through that and protect the people around you too. I've had COVID and I've had the vaccine, and between the two, it's an easy choice. I'll take the vaccine any day. Getting vaccinated also comes with another important benefit. It is the only way that we as a community, as a Commonwealth, get back to normal. Vaccinated people can safely do more things. They can socialize in small groups without masks or social distancing, for example. They don't have to get COVID tests before they travel. Last week, we updated our mask guidance to align with new CDC guidance that vaccinated people don't need to wear a mask outside unless they're in a crowd. Starting May the 15th, next weekend, we're planning to relax a few more measures. This means 100 people at a social gathering indoors and 250 people outdoors. 50% capacity for indoor entertainment venues, up to 1,000 people, and 50% capacity outdoors with no cap. Restaurants will be able to return to selling alcohol after midnight, and dining rooms can stay open later. This is possible because everyone has been working so hard and so many people have been getting shots. We need to keep doing that. If our COVID numbers keep trending down and our vaccination numbers keep going up, we plan to lift our mitigation measures, capacity restrictions, and social distancing requirements on June the 15th. We'll continue to evaluate our mask guidance. But this is good news, and it's thanks to the millions of Virginians who have done the right thing for so long, and I say thank you. We still have work to do. We're not at the finish line yet, and we still need to take the precautions that we all know work. But we're approaching a time when we can think differently about how we interact, especially people who are vaccinated. So please, I'm gonna say it one more time, get your shot. If you're on the fence, talk to your doctor. The vaccine is free, it's easy, and it could save your life. It's the best way for us all to get back to doing the things that we love to do. Now, before I turn to your questions, I want to note a couple of celebrations this week. First, this is Teacher Appreciation Week. I would not be standing here today if it was not for the excellent teachers I had when I came through school. And this year has taught us all a much greater appreciation for everything our teachers do to help our children. It's been a difficult year for teachers, students, and everyone else.